So we have forgot to add one thing, that's blood supply of heart. So for that, so this is the ventricles of heart. So now see, this is right side. All right, so this is the side of right coronary artery and this side of left coronary artery. So now let's see. So right coronary artery supplies what things? First of all, it supplies right ventricle and right atria. Then after this supply, left ventricle and left atrium. That's obvious. Then after, the thing which you need to know that this portion and this portion are supplied by right coronary artery, and those both are posterior one. So what is this structure called? So this is interventricular septum. So you need to say posterior part of interventricular septum and posterior part of what? Left ventricle, that is also supplied by right coronary artery. And in this case, you can see this is interventricular septum. So this anterior part of interventricular septum and anterior part of, so a small portion of anterior part of right ventricle. All right, so simple thing is that small portion of posterior part of left ventricle is supplied by right coronary artery, and a small portion of right ventricle is supplied by left coronary artery. So left side is generally supplying anterior portion and right side is supplying posterior portion. So you can see it is supplying posterior interventricular septum, then after posterior part of left coronary artery, a small portion, and left coronary artery is supplying generally anterior portion. So it is supplying anterior portion of interventricular septum and a small portion of anterior part of right ventricle. Also you have seen there that they have given an anterior interventricular branch. So left coronary artery has given also anterior interventricular branch, and right coronary artery has also given men population posterior interventricular branch. So although the only the thing is that their origin is from anterior side and posterior side, so that is just opposite. But if they are capturing the portions, they are generally anterior and posterior. So if you remember that right coronary artery origin from anterior portion but supplies other structures posteriorly mainly, where there is name like that. So posterior interventricular branch, then after posterior part of the septum and posterior part of left ventricle. In the same manner, the left coronary artery originate from left posterior portion, but it gives anterior interventricular branch where the naming is, and then after also anterior part of interventricular septum and a small portion of anterior part of right ventricle. So I hope I could make this clear. So thank you.